Hi, my name is Mr Kumar. I'm a consultant orthopaedic surgeon here at Pall Mall. Today we're going to be talking about knee problems. Knee problems are very common. They can give you pain. You can have symptoms of locking, giving way, but you may have had a fall or sustained a sporting injury. Common conditions found in the elderly population is osteoarthritis, but even rheumatoid arthritis can affect your knee. If you have any symptoms of pain which is debilitating your ability to walk, function, or even do stairs, you should come and see me for prompt assessment, investigation and treatment. Treatments may include physiotherapy, injections with numerous different agents, or even surgery. I specialise in hip work, and particularly what you have to look out for with hip symptoms is if you have groin pain or pain going down your leg. If you struggle to put your shoes and socks on, walk for long distances, or bothered by pain at night which is affecting your quality of life, you should seek prompt assessment and investigation. The most commonest condition that we experience in the hips is osteoarthritis, and this can be quite a debilitating, painful condition. As it can lead to a lack of mobility, it's important that we have prompt assessment and treatment to consider various interventions which could include injections, physiotherapy, and more commonly total hip replacements. I'm going to talk about lumps today. So lumps are very common all around the body. It could be on your arms, your legs, even on the trunk. Common lumps that we do encounter include lipomas, cysts, ganglions, and even suspicious tumours and lumps which might prove to be cancerous. You should come and see me to investigate these lumps and assess them to ensure that they're not cancerous. But also, even if you do want them removed, then I can offer that here at Pall Mall Medical. I offer the expertise, prompt investigation and treatment with clear explanations to put yourself a peace of mind.